It's super exciting for students to get their white coats. The white coat ceremony is incredibly important for our students, DVM students and our vet nursing students, because it signifies entering a medical profession.
The white coat ceremony is when our students are going from didactic, meaning to the classroom, to the clinic floor. So it is a big time and it's an exciting time for us as faculty, as well as for their families, their loved ones. And so it's the first time that they're going to be working and interacting with the public. So they're going to be working with client-owned animals and actually get to use all the skills that they've been practicing.
The students have their white coat or transition ceremony after about 2.5 years, so it's midway through the 6th semester. So they spend a little over 2.5 years in the preclinical curriculum, and then they'll spend a little more than a year in the clinical curriculum.
The white coat really represents that student turning to being a student practitioner rather than a student. So we're now going to start to practice our skills, utilize those skills, and hopefully put away some of the books and actually get our hands on these patients and really make an impact on that patient's life.
So it really shows that they have now entered a profession that's valued in supporting animals, in our case animal care, animal research, animal science. And that white coat really exemplifies that they are now having to adhere to certain values for the profession.
I think the students have had a great time in the preclinical curriculum, but the clinical curriculum and being on the floor in the hospital is what they waited for 2.5 years now, what they really came here for, so they're very excited.
It really welcomes them to a medical profession. And we as a consumer of medicine really value someone in a white coat. And we associate that with a certain level of education, a certain level of empathy, a certain level of care. And the white coat really illustrates all those values.